Hi everyone, this is Nicole Struthers. We're going to cover a bone marrow prosection today. So I have my bone marrow. It says it's from the right anterior iliac crest, bone, marrow, and clot. So both my bone core and my clot are received in one container. So the specimens can be received either together in one container or as a part A and a part B. So just be mindful of that when you're grossing these. I also have my decal container because we need to decal our bone marrow core. So I'm looking at our specimen. We have our core and we have our clot. So our bone core, we're gonna measure in length and diameter. So I would say the specimen A is received in formalin, labeled with the patient's name, comma, date of birth, and open quote, right anterior iliac crest, bone marrow, and clot, close quote, period. The specimen consists of a 2.0 centimeter in length by 0.2 centimeter in diameter, tan white cylindrical fragment of bone, period. And that's all you have to do for your core. Your core should then be placed in a cassette with sponges or a biopsy bag. The cores do not need to be sectioned. You can leave them intact. So that's all you have to do for the core. For your clot, this would be a new paragraph. And then I would say that the specimen contains a 1.5 by 0.7 by 0.4 centimeter tan pink to tan red fragment of clotted blood, period. And this is pretty tiny. I can submit it intact. It's not very thick. If it was thick, I could serially section it or bisect it. So with the clot, this can go in a biopsy bag or in between lens paper. I try and avoid lens paper at all costs because the clot can stick to the lens paper. And I try not to put it in sponges either because the clot can get stuck in the sponge. So after that, then you can put your cassette in your decal, or you can just put the specimen in decal. And this needs to hang out just for a little while. So in lab, you can practice leaving it in there for a couple minutes. So with your core, you're measuring it in length and diameter and giving a description, submitting it entirely, you can leave it intact. And then your clot, you will measure it in 3D, give a description, and then you can leave it intact if it's small enough, or you would serially section it. And then the two components are submitted in two separate cassettes. You'll also want to document that you decaled the bone marrow core and what decal you used. So there's a special type of decal called EDTA, and that can be used on specimens that may need molecular studies. Like if there is a possibility for metastatic breast cancer, they'll want to do additional special studies. So submitting it in regular decal would hurt the antigenicity of the specimen, so they wouldn't be able to do those extra studies. So we use the softer, more gentle decal. Let me know if you have any questions, but that is all for a bone marrow prosection.